All right, we are now recording for our monthly State TA Day call. Today is 9:26, a little after 1. We'll go ahead and get started here. We've got Kathleen here to talk about my friend Ben. So Kathleen, if you are ready, go ahead and take it away.
Thank you so much. We appreciate the time today, and I'm joined by Elise Henson also, who is the Executive Director of My Friend Ben. So Elise and I are both going to co-present on this. We're both with Gary Community Ventures. I'm the Manager of Partnership and Research for My Friend Ben, and Elise, I'll let you introduce yourself and get started.
Great. Yeah. Echo the thanks for having us here. As Kathleen said, I'm leading this project as we go from sort of a successful pilot to the next step of scale. So we were thinking we have about half an hour with y'all. So I was going to start with a relatively quick deck about what this project is, why we built this tool, what we've been doing with it statewide, why we think it's relevant to the folks on this call. And then I'll turn it over to Kathleen to do a really quick demo of the tool and talk a little bit about sort of partnership options for integration. So I'm going to try to share my screen. Great. So I will sort of zoom through here, but want y'all to have context of what it is that we're up to. So as Kathleen said, we both, this is a project that's incubated at Gary Community Ventures, which if folks don't know, that organization is a Denver-based philanthropic organization focused on increasing opportunity for low-income kids and families in Colorado with a focus on families with really young kids. This project is in our family economic mobility body of work and is all about helping to build a foundation of financial stability for families by increasing access to the social safety net, so to public benefits and tax credits in particular. We started this project because Gary had a group of about 100 low-income households, largely in the Denver metro area, but some statewide, that were getting some modest direct cash assistance on a monthly basis over the course of a year. But we were really using them as an advisory group and a sort of longitudinal one. So we were having pretty frequent conversations with households, like once or twice a month, to say, hey, what's going well in your life right now? What's a challenge? What is a pain point? And even when we weren't asking directly about sort of benefits and access to supportive services directly, we heard over and over again that it was a real pain point in people's lives. It was difficult to understand the full set of programs that were out there. Folks were telling us, I'm navigating across a whole bunch of different government websites. I'm not sure where to start. It's confusing. Even when it lists eligibility, it can be really hard to sort of translate into understanding what's available for my particular household and where I should start on this journey. So this is a project that really came out of direct conversations with community members, and because of the way we work, which I'll talk about briefly in a minute, has really been informed by that set of households and many more throughout the process. We built the tool in partnership with those folks. We said, okay, we're thinking about asking this question. What do you think about this language? Does this make sense to you? Is this an inviting way to frame this part of the tool? All sorts of things like that. And we're getting a lot of really close feedback throughout and continue to do so. So what it is, I'll give you like the really sort of top line understanding of what it is, so you have something to hang your thoughts on. And then, as I said, Kathleen will show you what it actually looks like in action, and then you'll really have a sense of it. But what this is a free online tool. It's made to be used on phones, but can be used on any device that has internet access. And what it's doing is asking you a quick set of demographic questions about your household, like income and number of folks in the household. And then in about 6 minutes, which is how long it takes most people to go through it, it's predicting likely eligibility with a high degree of confidence, cash value of each program and time to apply, And it's bringing together sort of the household view of that. So it's not just saying like follow by strand or by administering agency or institution. It's saying regardless of who controls or funds this program, for your household across federal, state, and local benefits down to the county level, and tax credits at the federal and state level, and then some nonprofit programs. Here's the list of things that is available to your household and about how much cash value you could assume each will deliver to your household so that you can make a real plan and get started. So you can see a screenshot of the results page. I'm going to move on because Kathleen will show you in detail. I think in addition to being in touch with community members from the very beginning and really responsive to community demand, the other thing we're really proud of in this project, and that continues to be true, is we've been very intentional about building trust and ensuring accessibility for this tool. And that again came out of these conversations with folks where we were asking what would make you trust this tool, and then really holding tight to those design principles. So we don't require any personally identifiable information or email or account. There's no gotcha. That can often be a barrier for accessing digital services. Kathleen will talk about how we handle citizenship, but again, we didn't ask that directly because we heard from folks that they didn't want us to. As I said, it's designed for use on mobile devices, and we see a lot of use on there, but it can work wherever there's internet connectivity. Fully translated into 11 languages. We basically took the Denver Public Schools top languages, and it's fully translated in all of those. We run everything through a readability checker to make sure it's at middle grades readability. It meets some more technical accessibility guidelines for web content and works with things like screen readers for folks who are visually impaired. So this has really been a priority for our team and something we spent a lot of time on, and we are really proud about where we are. It's particularly relevant for this audience. It includes key family support resources. So you'll see again when Kathleen goes through, but things like healthcare, food and nutrition programs, cash assistance, housing and utilities, which we know folks are in dire need of, childcare, preschool, sort of youth programming, transportation, and tax credits. We have had a set of truly incredible partners in this work from the early days when we were talking to folks who are already helping to navigate households to the types of services they might need, to say, is this something that feels useful? Like, do you already have a system for doing this easily? And making sure that there was demand on that side of the coin as well, all the way to improving the tool, like getting feedback on specific features and all of the other things that we've been talking to folks. So just to name a couple partners here, although there are many more, we've had a really great partnership with 211 out of Mile High United Way, where both folks in their call center and on their website, this is a resource that they direct folks to, and we get a lot of traffic from that channel. We just this week launched with Denver Human Services and had a number of events talking to both folks in the mayor's team, city council, and then had a press conference yesterday. So folks might see some news coverage of that, which is very exciting. And then Jeffco Human Services and some other county human services departments have been longer time partners and have been integrating this into their workflows. And then you can see some of our other nonprofit partners here. I would say the value add to partner organizations, and you can think of this like quite broadly, and schools and LCOs would be another venue for which this is true, is that folks working in those settings are coming in touch with families on a daily basis and are often navigating them quite adroitly to a subset of benefits or a bundle of programs that they're really familiar with and that's really sort of in their core competency. And what this tool allows folks to do is say, yes, I'm going to definitely serve you with all of my expertise in the early childhood space, but I also can make sure you're aware of the other supports that are out there that will help with sort of financial stability and like upstream foundational stability for your household. So that's been what people are really excited about, is it really increases their capacity to do that navigation with a high degree of confidence. Just really quickly, we have seen great impact in Colorado so far. So we had a public launch really around last spring. We've screened over 20,000 households. On the median value that folks are finding is $30,000 in annual value, or about $2,500 in value a month. That's not necessarily obviously direct cash, but that's the value we estimate for different programs. And we're projecting that we've delivered at least $11 million in value to households who have gone through the tool, better understood what's available, had an easy on-ramp to apply or to get help applying. So that's where we are. This tool is being replicated right now with a partnership in North Carolina, and we've just received some national funding to go national with this. And so we'll go to another 2 to 3 states in the next year, which is really exciting. We basically can take everything that's going on in Colorado and turn around to other states in the country and say, look at the ways that folks are increasing access and utilization of benefits in the state. So that will be really fun. I've mostly said this is a little bit more technical, but just to sort of double click on the way we work, we do testing and iteration. Our technical team is literally releasing improvements on a weekly basis. So every Friday, we're sort of improving the technical side. That could be adding new programs, disabling programs that might be seasonal or out of funding, and then improving the user experience of the tool. So it really gets better and better. And the more we hear back from folks about what works and what could be better, then the better we make the tool. And then I've sort of already said this, but yeah, just very user-centered, both at the partner organization level and experts in the field, and then directly with community members. I'll say this really quick, just some fun things about where we're headed, because we always love getting feedback from people about where else we should head. So take this in that spirit, and then I'll turn it over to Kathleen. But I just mentioned we've got a national expansion. Everything we learn here and everything we do here, we can hold up as a model as we go to new places. We're thinking about new design features. A thing we've thought about a lot and haven't done yet, for example, is sort of a cliff calculator, helping people understand benefits cliffs and how changes in their employment might affect what they're eligible for. So there's other folks who have done that work, and we'd love to learn from them and build something like that into this tool. We've got a real focus on county partnerships, but we've also done a lot in the early childhood space. So I think there's a lot of just other partnership opportunities across the state so that we can make sure this is available to folks for whom it's relevant. And then thinking more about some other customized pathways. So thinking about specific populations that we might be able to serve even better. So folks with disabilities or older adults as one example. Okay, I feel like I took a long time. Sorry, Kathleen, I'm going to stop and turn it over to you.
All right, thanks so much, Elise. I'm going to go ahead and share my screen. Okay. All right, so the screen you're seeing here is the Colorado website. This is getting a facelift. This is going to look very different in the next couple of weeks. So this we'll put the URL in the chat, but this is the Colorado version. So we get started by clicking here. And then as Elise mentioned, the tool is available in 11 different languages. You can get there a couple of different ways. You can start here and go to the drop-down menu, and all of the 11 languages come up there. Or you can come here. Elise mentioned user testing. This is one of the steps we're really proud of adding. When we first unveiled the tool, this step wasn't there. And when we added the language preferences step 1, our Spanish uptake of the tool like almost doubled overnight. So people really liked knowing that they could go through the tool in their language. So I'm going to click English, get started. This is our landing page. It has 2 important reminders. The first reminder is that we are a benefits eligibility estimating tool. We are not the application. We are not Colorado Peak. So based on the information people give us, we can give them a good estimate of what we think they're eligible for, the estimated value, and the time to apply, but they would actually then have to go through the application process to get the final determination. The second point here ties to the public charge guidance on the Colorado Department of Human Services website. This is one of our most popular clicked links. People we know have a real concern about public charge and how public benefits can impact that. So this just directs people directly to the official guidance on that. I'm going to click that I'm ready to go. I'm 13 or older. We ask some basic demographic information. We are available statewide. So we start with the zip code. I'm going to use a Denver zip code. So when I put that in, I'm prompted to select a county. But again, you could put in any zip code in the state and you would get a drop-down menu with the county you might be in. So Denver County, click continue. I'm going to say, in the interest of time, that I'm modeling with a 2-person household. Click continue. We ask everyone's age. All of the different questions we have built in here do impact specific benefits eligibility aspects. So we ask about health insurance for each individual household member. I'm going to say that this person does not have health insurance. If, for example, she had Medicaid and clicked Medicaid and we determined she was likely eligible for Medicaid, it wouldn't show up in results because we're learning here that she would have Medicaid. But I'm going to say I don't have health insurance. We ask some special conditions here. I'm going to put down that I'm pregnant. And then we ask about income. And you will see as you go through the tool that we have these question mark help text bubbles throughout the tool. So someone may have a question, for example, what does income mean? Is it the gross income someone is getting, or is it net income after taxes? So if I click this question mark here, it tells me that income is the money earned or received before deducting taxes. So I know it's gross. But again, you'll find these question mark bubbles throughout the tool. So if I click yes for income, different fields open up. I'm asked what kind of income I've recently had. Oops, sorry about that. I'm going to click that I have wages on. But you'll see we've got several different earned and unearned income sources here because some programs do count unearned income differently than they do earned income. So I'm going to start with wages. I'm going to say that I make an hourly wage. I work 30 hours a week, and I'm going to put in the Denver minimum wage, which is $18.29 an hour. If I had another income, child support, some freelance work that I was picking up, I could add that and then keep going. If I make a mistake and I don't want to add something else, I can just click the X to get out of it. I'm going to click continue. I'm going to say that I have a 2-year-old in the house, several different relationship options here. I'm going to say this is my child. They also do not have health insurance. I'm going to say that none of these special conditions apply to the child. And because it's a 2-year-old, there's no other income in the household. We ask about expenses. They can affect benefits, particularly as it relates to SNAP, where different housing exemptions, medical expense deductions can come into play. So I'm going to say yes. When I click yes, additional fields open up. We prompt people to give as much detail as possible because it is useful to determining the results. I'm going to keep this simple for purposes of today. I'm going to put 2 expenses in. I'll say that we pay rent of $1,200 a month. And I'm going to add in a part-time childcare expense of $400 a month, but I could certainly keep going. But continue. We ask about resources in the form of cash on hand a household may have. So I'm going to say we have $200. We ask if the household currently has any benefits. This is also a step we added with user feedback. People told us that if they already had a benefit like SNAP, it felt like double counting for them to also see SNAP in results. So if I want to tell the tool that I do get other benefits, if I click yes, additional fields open up where I can select the programs that are in the tool. So those would be excluded from results. So if I click TANF, for example, and the tool determined I might be eligible for TANF, it would not appear in results. If it feels too personal to say yes or no, you can just say prefer not to answer and keep going. This is a step where we ask if the household is in immediate need of resources because, for example, perhaps the household believes it's eligible for SNAP, it's going to apply for SNAP, but knows it could take 30 days to get that approval, but they're worried about feeding their family this weekend. They may need more immediate food resources. So I'm going to say we need food or groceries. I'll also add in diapers or baby supply since I have a 2-year-old and I'm pregnant. And then we have these other categories here, housing expenses, behavioral or mental health challenges, concern about child development. This is also a popular one, low-cost dental care. We have a list of statewide low-cost dental clinics for people to go to. So I'm going to click continue. We ask about referral source. As Elise mentioned, we have several key integration partners we've been working with. Several of them are in this drop-down menu. If you are working with a client through your organization, you could click the other and then type in the name of your organization. If you're playing around with the tool just to see how it works, we would ask that you click test prospective partner. That way we don't confuse made up data with the real data. So I'm going to click continue. This is the one step where people can opt in to provide personally identifiable information, but it's completely optional. We have 2 boxes here. You can check one or both. The first one says, notify me if new benefits become available I'm likely eligible for based on the information I provided. We have been using this feature in a couple of different ways. Earlier in the year, Colorado had a temporary rental grant assistance program that was open for about 4 or 5 months. We were able to match people on the back end based on their income with people who checked this box, and we send out emails and text to people alerting them to the program and advising them of what the application windows were. We had like a 40% open rate on those messages. We also recently used it in Boulder when there was a short-term cash assistance program that was open for families with young children. And then we also do offer paid opportunities to provide paid feedback on the tool. So if I click one or both of these boxes, I'm prompted to give my first and last name and an email or cell number. But again, completely optional. You can deselect and just keep going through the tool. This is the summary page, so I can go back through this and make sure I don't have any incorrect information or anything I want to change. This all looks good, so I'm going to click continue. This is the results page. So for this particular household, we've estimated they may be eligible for 15 programs with estimated monthly savings of about $3,200 and annual tax credits of $9,600. We keep tax credits separated out. Also, that was based on user feedback, since that's more of a lump sum kind of cash payment than a monthly source of payment or savings that a family might enjoy. So this is a list of programs. It's by ranked order value. So housing and utilities comes up as the program that might offer the most value to a household. So we've got Colorado Emergency Rental Assistance Program. Because I put in a Denver zip code, Denver has the TRUA program. You'll see some other housing related programs here because we're doing this demo in September. LEAP does not come up, but LEAP will be activated on November 1st. And if I were running this test in November, you would see LEAP in the housing results. So we have the tax credits here, healthcare, we've got Medicaid for this particular household, CCAP, SNAP, we've got WIC, which might be really interesting and supportive of the families that you work with, and then RTD Live. So if I come here, for example, to WIC and click more information, it gives me a couple of different options. It gives me the ability to apply directly online. For all of the benefits, we do have a direct application link. For programs that are available through PEAK, you would get directed to PEAK. For programs available through the Social Security Administration, you would go to that one. For this leads you to the WIC referral form. We also, for each benefit, have navigation organizations that can help apply for that program. So in this case, we have Benefits in Action, Aurora Community Connection, both of which offer statewide bilingual resource help, and then the Colorado WIC clinics. For each resource, we mention the required key documents. We hear from navigators and caseworkers that people often don't know where to start with the documentation. So we try and give people a starting point so they know, do they need proof of income? Do they need a social security number, an ID, kind of those basic things they may need to get started for a particular benefit. We give a summary of the program. As Elise said, we ran everything through a readability tool to come to middle school readability. These are the near-term benefits. So I had checked a need for food and diapers. So we have some different resources here. We have the National Diaper Bank Network for regions in the state where they are served by a National Diaper Bank facility. We also, if you're in a more rural area and maybe don't have a diaper bank there, we link to Family Resource Center Association resources. And then we have some food resources here, like Hunger Free Colorado runs a statewide food resource hotline for families in need of immediate food assistance. These, oops, sorry, went back one step too far. This is the citizenship filter. Elise mentioned we don't ask about citizenship, but we give people the option to filter for citizenship. So if I click here and I'm curious what might happen to my results if I don't have citizenship, I can click that. I still have 10 programs that are potentially available to my household. And because I clicked non-citizen, my Medicaid benefit turned to emergency Medicaid, since that would be available to me. The last thing I'll mention here before I go back to the deck is I can save my results. I can bookmark my results if I'm on a private device and I'm comfortable doing that. I can also email and or text my results to myself, to a family member, to a caseworker, a navigator. When you do that, you get a link to your results page, and then you can just click on that link whenever you need to get back to your results. And the great thing about that is if, for example, you are going back to your results in November, you would see LEAP in your programs. I am going to switch briefly over to the deck and finish that part up because I know we are almost at time. So we are able to do a variety of integrations with partners. This is an example of some of the work we've been doing. We are on Human Services websites in Jeffco and Denver. We are getting ready to launch with at least one other county in the next week or two. So we have buttons on the websites where someone can go in, they go in through a customized link, and then they can get their results going through that Human Services organization. With an appointment booking or CRM, we have a partnership with Benefits in Action. where they have an intake form on their website where if I'm interested in services, I can go to that form. I can fill in some basic demographic information, tell them when I might be able to chat with them about the help that I need. And then that form links into My Friend Ben, and that then goes into their database. And that way, when a navigator meets with a family, they've got the My Friend Ben results, and that can help guide and focus the conversations that they have. Automated communications, we've done some work with Bright by Text. We find that texting is an effective way to get My Friend Ben into the hands of families. And then we're also a standardized step in case manager workflow in Jeffco, for example. In Jeffco, we have trained all of the child welfare caseworkers, and My Friend Ben is built into the workflow. So as they try and get a child back in a home, or they start to emancipate a teenager, they can run the person through My Friend Ben and come up with resources that might help support them. We have a Get Started guide if you're interested in working with your community. We have flyers that have QR codes that are scannable that you can share with people. We'll take them directly to My Friend Ben. We also have social media posts, newsletter articles, and text messages. These items are all in English and Spanish. The flyers are also available in Vietnamese, and we're willing to work with people if you find there's another language that would be important for your community. So that is, I'm gonna share one more tab, and then we'll open it up to questions, because we often get this question. So I'm just going to find this for you, and I'm gonna share this tab. So if you go to our homepage, you'll see a button that says Current Benefits in My Friend Ben. This tells you all of the benefits that are in the tool. So we have 42 long-term benefits. They're all categorized. If you come down here, for example, and see LEAP, you'll see that it's seasonal. So you can come here, long-term benefits, short-term benefits. This does get updated in real time. So this is always current, but this is also a very frequently asked question that we get. So I wanted to be sure to share that page with you. With that, I will stop talking. Elise, feel free to jump in. We can take questions.
Yeah, I know we're almost at time, but if folks have questions in the chat or in real time, or obviously you're welcome to email us afterwards, but if we have a minute or two, we'd love to field any.
Yes. Can I just say, Kathleen and Elise, that was a lovely presentation. Absolutely fantastic. If you want to put your emails in the chat, we can put them with these resources as well. And that way, when we distribute this information after the state TA day, then everyone can also have those too, in case those questions come to you later on in the day. Yeah, so I'll just give it a minute. I don't see any questions in the chat, just a lot of praise that this is a really, really cool tool.
Kathleen, you're muted.
Thank you. Sorry about that. I was going to put a link to our Get Started guide in the chat also that has the communications materials so that you can access those also. So you should have that now.
Perfect. All right, I'm not seeing any questions. Again, I know that they'll pop into your head as you all are tucking yourselves in the bed tonight. And I know that Kathleen and Elise will be ecstatic to answer those questions. So like I said, we'll follow up with that information, the links that she's put in, as well as emails. Moving to our next presenter, we have Kristen Lang, and thank you so much, Kathleen and Elise. Thank you so much for presenting. Moving to our next presenter, we have Kristen Lang and Megan LeClaire, and they'll be giving us some SSBI updates.
Thank you, Lilith, and hi, everyone. Happy Thursday. My name is Kristen Lang. I am the manager of our State Systems Building Initiatives Unit at the Department of Early Childhood, and here with my colleague, Megan LeClaire. Megan, do you want to introduce yourself?
Hey everyone, good to see you again. My name is Megan. I'm the Preschool Development Grant Birth Through 5 Administrator on Kristen's team at CDEC.
So we are going to probably have just some quick updates for you today, but I never want to miss a chance to get to see and talk with you. So here we are. As many of you know, we have been doing local meetings, partnering with many of you on the call to really think about how to make the new statewide early childhood needs assessment and the new statewide early childhood strategic plan meaningful and relevant for your communities, and to identify how the needs reflect the needs of your communities, and how the strategic plan really talks a lot about the work you're already doing in your communities to advance your early childhood system and give you some ideas about ways that you might want to build on that work. So those conversations have been absolutely incredible. We've so appreciated how welcoming you all have been, inviting us into your communities and being able to meet with you and your partners and have these conversations. We, at this point, all of the locations that are italicized are those that we've completed. We have a few more coming up, and we are so excited to have been able to add a trip to Trinidad because we knew we were missing certain places and kind of needed to see how the budget played out. But we are really thrilled to be able to go down to Southern Colorado as well. And so, yeah, just a huge thank you to everyone that's hosted us. And just a reminder again that we are hoping to continue these conversations, and that will depend on what funding we can identify. But we expect and hope that this will be the beginning of our road trip to do these events and be with you in community. But based on our new PDG grant application, whether we have funding for that or how much will dictate the additional locations we'll be able to go to in the future. And speaking of that, I have talked to you all before about the fact that as a state, we have applied for a new round of preschool development grant birth through 5 funding. As many of you know, this has been an incredibly important funding source for Colorado over the last 5 or 6 years now. It's brought in close to almost $40 million into our state's early childhood system to do things like create the shared measures with you all, and support the mini grants and the local convenings and tons of other work. And so we're really hopeful about the application, and oh my gosh, we find out tomorrow for the award that would start Monday. So really hoping that you will be getting an email from us soon that is like, hey, we did it again. We're so excited. Many of you contributed to the strategies that went into this application. So yes, hopefully hearing from us soon. But I do want to let you know that our federal partners are hoping, if we aren't able to receive funding this federal fiscal year starting on Monday, that they would be able to fund the other states that don't get it the following federal fiscal year. So starting in September of 2025. But of course, we would love the money sooner rather than later, and there's no guarantee they'll be able to fund everyone even in 2025. So fingers crossed, keep all your fingers, toes crossed. If you believe in gems, like, use those. I don't know how they work, but whatever you can to bring good luck to our state. Yeah, hoping for good news soon. We also have talked previously about another grant that our unit oversees, which is the Early Childhood Comprehensive Systems Grant. I wanted to bring this back to this meeting today because there are a lot of really exciting things that are just on the cusp with this initiative, and just to encourage, if you are not currently involved, but something about these projects is really exciting for you and you want to become involved, there's information here for you to do that. So at a very high level, this grant is focused on better integrating Colorado's maternal and child health and early childhood systems. Practically speaking, what we're getting into the nitty-gritty with is a few projects. They're broken up by implementation teams. We have 3 of them. One is centered on equity, and that group is in sort of the final stages of creating a prenatal to 3 equity action plan for Colorado, which is really exciting. It's going to build on that new statewide early childhood strategic plan, but be more specific about exactly how to achieve equity utilizing those strategies. So we're excited for that to be developing concretely over the next year. Another implementation team is the partnerships implementation team, and that team is just on the verge of solidifying some priority policies for prenatal to 3 in our state. So there was a big list of policies, narrowed it down, and we went from over 100 to just under 60, got some great feedback from the Department of Early Childhood Family Voice Council, but still have quite a bit more narrowing to do. So if you really love policy, you're really passionate about prenatal to 3 policy, you want to join that implementation team, you should do so. And then finally, there's an implementation team focused on coordinated intake and referral systems. They're doing a ton of work to really think about how you bring family voice meaningfully into the early childhood developmental health system. So interesting new training for both family leaders and those who are incorporating family leaders, as well as some really great work around a family engagement checklist that supports a family engagement framework. So organizations can just double check, are they really meaningfully engaging families? So if you're really passionate about that kind of work, you're interested about the e-referral work that's happening with early intervention and different health systems, coordinated intake and referral systems is your implementation team. If any of this sounded really cool to you and you want to learn more and sign up, you can utilize the links at the bottom of the screen, and we will send a copy of this presentation to Lilith so that you can go in and view information directly there. Okay, Megan, I will pass it over to you.
Thanks, Kristen. Okay, I'm here once again to talk about, I feel like that Bernie Sanders meme. I am once again asking you about shared measures. But go ahead, next slide, Kristen. I am so excited to report that we had 100% participation this year on the shared measures from all of you. So thank you so much. That's huge. I know councils are managing so much. I know you all have gone through staffing changes, and there's lots of personal issues because we're all people. So we're all going through things in our personal lives too. And everyone has been able to manage so much. And so just really proud and really honored that all of you took the time to do this work that I've been working on with you for the past several years. And so thanks again so much. On the slide, you can see on the little chart, calendar chart, there's September, October, November are blue, and that's because we are in the midst of the analysis portion of this. And so you all turned in your data collection forms at the end of the summer, and then we are analyzing the data right now. So getting through the quantitative pieces, and we're moving on to the qualitative analysis pieces in October and building the dashboard. So we hope to have the dashboard finalized actually by the end of October. And the reason why it says through November is because it takes us about a month to get things through CDEC clearance. And so once the dashboard is through clearance and our communications team has time to make sure it's accessible and all of that beautifying that goes into making things ready for distribution. We're hoping that will be done by the end of November so that you all can start using the dashboard a little bit sooner than you did last year. So very exciting. Thanks again. That's all I have on the shared measures. I've been emailing a couple of you because I've been needing some clarifying from some of your data entry. And so I appreciate everyone's responses so quickly. that's all I have to share on that. And then I'm sharing on behalf of Marika Padilla for the next piece. So Marika used to be on our team, and she's now the Family Resource Center Program Administrator at CDEC on the Family Strengthening team. So there's some updates I want to share about the Small Business Development Center Childcare Business Training. So next slide, thank you. So there's a new annual report that's now available. This reporting period was January of 23 through June of 24. And so moving forward, the reporting period will align with state fiscal year, but this one was a little wonky. The report included project data, shared successes from small business development centers, councils, licensing specialists, and testimonials. The business training report was shared via email with the councils who supported the SBDC business training. So I don't have a link or anything to share with you right now, but you should have received it via email. Oh, Kristen has it. Thank you. And if you have any further questions, you can email Marika. So she was really excited to share this information. So I hope that I did her a solid and I didn't miss anything. But if I did, please email her. So thank you all so much. And here's our email addresses if you have any questions for me or Kristen. But as always, appreciate the time on these calls to give you some updates.
Thank you, Kristen and Megan, for presenting those updates. You did good. You did good, Megan. It was wonderful. If anyone has any questions, we've got a minute or two. If there are any questions regarding those updates, if there aren't any, we can move on to our next presenter. Again, thank you so much, Megan and Kristen. This work is instrumental. I'm deeply saddened I could not help with some of the meetings that took place just because of other work things, but this is truly, truly wonderful work. So I'm very happy to be on the supported team, as well as all of the council supporting in with this work. Next, we have Elaine, who is going to talk about PDIS updates. Elaine, are you on the call? Because I can only see several little boxes.
Hello.
Perfect. Hello.
Sorry, I'm trying to get some last minute data to share with you guys.
No worries. We're a little ahead of schedule. And actually, if you need a minute, Che has put in the chat, how does one take part in the upcoming conversations? Che, is that related to the business trainings, or is that related to what Kristen was talking about? If so, Kristen, do you want to field that question?
Yeah, the local conversations that are coming up for the early childhood strategic plan.
Sure. Yeah. Is there a region that you would feel like you fall under, either Longmont, Lake, Garfield counties, or like the Trinidad area?
Trinidad area.
Okay, sweet. Yes. There's a virtual needs assessment conversation that will happen on October 16th, and information is going to go out about that next week. So we're just getting the ball rolling on all of that. So I'll make sure that you're included in that outreach, but that will be the virtual portion. And then the in-person portion is in Trinidad on Friday, October 25th. So we're sorting out venue location details, but that's the date that we're holding. So yeah, we have some flyers prepped that we're going to share for that for folks in that region. So I'll just make sure that you're included. Can you put your email in the chat?
Absolutely. Thank you. I'm glad it didn't go out yet. And
Yeah, still here.
Cool. And that was perfect timing for me to get my fairly sloppy data updated, but I hope it's still appreciated. So I am here today just to give a final plug for our income and benefits survey that we've had open throughout the summer. So it's within the Professional Development Information System, PDIS. And this little screen grab right here is cropped, but this is where folks can access the survey from. So when you log into the PDIS, this is a small piece of what your home dashboard looks like. So under your account menu above the graphics of the mountains, there's just a button. Once someone completes the survey, the button goes away, just to not confuse folks, but that is how it is accessed. And so I just kind of put some big hits here. So, you know, everyone here, we know that the early childhood workforce is undercompensated. And we want to do everything we can to try to address that. So having a good understanding of what compensation is currently available to folks is really important for us to be able to understand where there are needs and where we can provide supports and resources. So in order to get that information, we have launched this income and benefits survey that is going to be open every year from May to September. So it is closing at the end of September, which is Monday. And we have just been kind of doing a final push of communications to try to get as many responses as we can. The survey itself asks about job roles, wages, annual income, benefits, and social services use. Every question is there's a prefer not to answer option. So if anyone doesn't want to answer a specific question, they don't have to. And then this little, this is what I was working on before, so I apologize for its presentation. But as of right now, we have 813 folks that have completed the survey, which is fantastic. But if we look at this breakdown of kind of where their employment buckets are, we've got good representation of center-based providers. And then all of our other buckets, we would love to have more. So the more responses we get, the better we'll be able to break it down and look at regions and look at job roles and all kinds of things. So if this is something that any of you all have some communications going out this weekend or want to share with your folks, it would be great. I will send some language that we have that you can just copy and paste. Just a quick note on data privacy. These responses on the back end of the PDIS are hidden. So we know that we're asking for sensitive and personal information. And so we want to make sure that we are doing everything we can to keep that information safe. So it is even, you know, folks that do have back-end access to the PDIS for reviewing credentials and qualifications and whatnot won't be able to look at this data. It's really going to be just our analyst and some system admins that are able to access it. And then the last piece that I didn't add to this slide because it's fairly new, but we were able to get compensation for this compensation survey. So it's limited, but we do have a chance for 50, or what we'll be doing is once the survey closes, we're going to randomly select 50 people who completed the survey for our $100 gift. So I have language around that included too. I'll send it right after this, but we just want to spread the word and get what we can out to the community. A note about the $100 compensation, just due to policies, if someone wants a gift card, they will be required to complete a W-9 for our system or for our processes. So we're also looking into getting some like supplies that could be given in lieu of a gift card if anyone doesn't want to submit a W-9 for any reason. I just saw a question come through. Will it be broken down by county when analyzed? We hope so. And that's kind of where it comes down to this, how many people respond. So we do, with 813 individual responses, there's a good chance that we've got decent representation across the state. And if we do want to do some of the more nuanced looks, looking at like what do coaches get paid across the different counties, we would want more responses from that specific population. So I think overall we will be able to look at county level, but some of those more specific data points that look at subsets of the population, if we're looking by job role or program type or anything like that, it depends on if we have enough data to analyze it. Any other questions? All right, I will send, I'll send some resources in the chat in just a second, and thank you all for your time today.
Thank you, Elaine, for presenting updates on that. Again, super cool stuff coming out. Really good data, and we will make sure and get the follow-up information out to everyone as well. Thanks, Elaine. Our next presenter is Christy for E&E updates and some other cool stuff. So Christy, if you are ready, go ahead and take it away.
Hi, everyone. Good to be with you today. I do have E&E updates. So we can go to the next slide. And you'll see Salesforce updates. So by the end of next week, Salesforce should be fully functional. You will hear about it in the chatter, and we'll be communicating with all of you once it is fully functional, but that is our expected time frame. So once it is fully functional, then MOUs will be issued. We're hoping around October 15th for all of those newly made eligible E&E applicants. And then, the MOUs will go out and you'll sign them, and then providers can start submitting for reimbursement. For some of the councils on this call, you've received our form to complete to close out your contract. And this is just a friendly reminder that those are due by October 11th. After we get those forms back from the councils that are closing out their E&E contracts, then we'll be sending out a form to the councils that need amendments for their E&E budgets. Claudia, I can take your question now.
I just want to verify. We just recently got approved for Stratton, and I did get your email that I needed to close up. Do I just disregard that and don't pay attention to that? Okay, I just didn't know if there was something I needed to do to not have it done.
No, but you got the form, and then we approved Stratton. So just disregard the form, because you'll have that E&E application as part of your amendment. Any other questions about that? And if not, we can move on to the next slide. So starting next week, office hours, we'll have our last office hours on Monday. The invite stayed the same. And then moving forward, E&E office hours will just be on Wednesdays from 10 to 10:50. The link stayed the same. If you've been on that invite, I just extended it to the end of December of this year, and then we'll just play it by ear based on the needs that that the councils have in regards to E&E questions. Next slide. So here are the links again. We are still accepting requests to transfer funds. That's what I want to say. So you've got the link to that on this slide deck. And then if there are any E&E applications that you're unsure of the status, typo, I will fix that. Complete the ready to review form. I know that we have found a few other applications that we want to look at, and we're counting on you to kind of check in with us and say, hey, there are a few more applications we'd like for you to look at. That's all I have. Any questions for me about E&E? Okay, thank you so much.
Thanks, Christy. You are ahead of the game. We've got a few minutes. We can move on to our next presenter if no one has any immediate questions. Carolyn Romero, if you're on the call, again, I can only see a set amount of box faces, which is unfortunate.
I don't see her. I'm going to chat her, Lilith, and see if I can't get her to jump on.
Perfect.
Hey, Michelle, are you on? She was also on that other call, so she might not be on yet.
Yes, we work many calls. Everyone is very busy. Let's see.
I know Michelle wanted to talk about possibly getting a volunteer for or two for a couple of our committees that are coming up. Let's see. She can bring that up. I don't know if you can chat her as well.
Yes.
I don't know if she's still on the call though. Julia, your name has already been mentioned, Julia. we need an alternative pathway committee member, as well as a committee member for our appeals committee. At least one, and 2 or 3 would be even better. So if anybody has some interest in that, if you would reach out to any of us, but Michelle's heading that up, we would be very, very appreciative. Angie, yay, thank you. That would be, I'm still trying to find Carolyn's name here, sorry. We would be really very appreciative of getting a few folks to help us with that. We're a little behind in some of those things. We've had Weld County and Mesa County's applications for a while now, and we want to get those reviewed as quickly as we can.
Let's see. Do you know maybe if we're having a hard time reaching Carolyn? Yes, Leah.
I can talk for a couple of minutes while we're waiting.
Yeah, Leah, go ahead.
As we're not on the agenda today. But we did want to let you guys know. Oh, good. Michelle's here too. See, that's all we needed to do. We are going to be opening registration for the foundations course this spring. And so I'll be sending out emails probably within the next week. Our goal moving forward is to offer foundations every year. So that's the training where we train our infant toddler specialists to teach in your community. And we're also hoping to offer the EQ Relate coaching training every year. We're in the middle of our coaching training right now, and it's awesome. So we just wanted to let you know, I know in the past we've offered it every other year. We're really hoping that if we offer it annually and at consistent times, that will help you with planning and help all of us in moving forward. So wanted to let you know about that.
So cool. And I think we had someone who said, could you please email the information? Vicki.
Absolutely.
Yes.
Ooh. Vicki, are you talking about EQ stuff or are we talking about Karen's stuff? Because I'm pretty sure you're on my list. Okay, perfect.
Okay. Yep. I'll add you to those to reach out to. All right. Let's see. definitely, Michelle will reach out. I also got Julia and Angie that would be willing to do some volunteer for it. And so get you on the list as well. Let's see. Do we have Sandy CCR on our team with us right now?
Yes. Hi. Hello.
Hello, Karen. Do you think maybe we could start with
Yeah.
Sandy, and then if Carolyn,
Let's see if Carolyn jumped on yet. Oh wait, no, she didn't. Okay.
yeah, I didn't see her when I was able to look at all of the people. We have a big group today. So I think if we're okay with that, if we feel okay, and when Carolyn joins, we can have her present on her information. But Sandy, if you're ready to present, we could just kind of switch things up.
Yeah. Hello. I don't have anything to present today, just my face.
It's beautiful. Wonderful.
My name is Sandy Basolto. I am a 211 supervisor over at 211 Colorado. I oversee our partnership with CDEC for the Colorado Shines Child Care Resource and Referral Line. Our team consists of 6 child care specialists, and we're all trained navigating parents and guardians through their search for quality child care providers. Because we're also a part of 211 Colorado, and that's where our contact center is. We provide other resources for parents and guardians to understand and navigate tools just like the My Friend Ben tool, or provide resources like rent, food, and utility payment assistance, just to really provide a holistic care approach to everyone that we interact with. I meet with Michelle monthly to learn about what's going on over at CDEC and what kinds of trends we see from parents and guardians that come through our lines as well. And I just wanted to hop on here and just share who I am, share my contact information so that we can all support each other. I know the councils work really closely with all of the providers, and we see a lot of the parents, families, guardian side of things. So I wanted to share my information. I'll put my contact info in the chat in case anyone wants to connect directly. But I would love to partner with councils and just get to hear what kind of trends and things you all are seeing as well. I'll plan to join these meetings moving forward as well, just so that I can kind of stay in the loop and know what's going on. But thanks so much for allowing me some time to be here. And I will put my email in the chat.
Of course, Sandy, thank you so much for stepping in and presenting. And I love your cafe background. I want a croissant.
Wish I was actually there.
It looks so real. I want it right now. Does anyone have any questions? Of course, we'll make sure that her contact info is in the follow-up that we send out. So again, if those questions come to you later on in the day or the week, you'll have that information. Let's check. Carolyn, I
haven't heard back from her. I was looking at her calendar. It looks like she's quite scheduled. I can't tell which meetings like she has on there. So maybe we should just push forward. And
Karen, you are actually next.
Yay.
Have a moment. And then if we don't hear from her, that would be our last one.
We'll do a follow-up. Yeah.
Mm-hmm. Yep.
And I will get my screen ready.
I'm happy to share too, if that's easier.
Oh, that would be easier, actually.
Cool. Let me just get that up and running. Gotcha. Okay.
So I don't know how many of you guys have actually met with other groups within CDEC that have gone over our WIG goals, but we have a WIG goal. And of course, our WIG goals lead into the work that you all do. So we're going to cover some of that today. But I also wanted to just share with you guys an overall kind of CDEC list that we've got going too. So that's on our second slide. Yeah, so we have 5 WIG goals, and our WIG goals, for those of you who are not as familiar, many of you are, but that's WIG stands for Wildly Important Goals. And these are goals that the governor's office selects for our department to focus on. And we have some input into like what they look like. They give us the topics, we formulate how we would measure them. And honestly, they are just kind of getting into the groove from our standpoint. We were just getting this information like last month. And so this is why it feels like we're presenting this kind of late, because we start these in July, but we're still hashing out. And frankly, on one of ours, we're still hashing out some measurement issues. But so we'll talk through these, but just generally, I wanted you guys to know we have 5 WIG goals. 2 are around the Universal Pre-K program, preschool program. One's just on the uptake, as you can see, like, you know, increasing, I think that's around increasing enrollment. And then one's around provider retention. There's a school readiness goal, which seems really broad. So I was kind of reading through that a little bit. So that also has some relation to the Universal Pre-K program uptake, the early childhood mental health consultation outcomes, evaluating CDEC's impact on school readiness generally. So I'm assuming that maybe that might be around some of the scores and things that will be collected within UPP over time. Home visiting is mentioned, as is the ESIDS, or integrated data system. So probably more information to be shared on that as we kind of get into those. Our WIG goal is under childcare quality, provider quality, and some of you on the call with me today are, just go back one more slide, please. Back to the original one. Okay, no. Yeah, there, thank you. So some of you on the call will know that we have embarked on this journey in the past, and it has been resurrected. So I'll talk through that in a minute, but I also then our final WIG goal is on infant, toddler, childcare capacity, and that's tracking, I think, our licensed childcare churn trends in this space and those programs that are feeding into infant and toddler capacity. I think Family Friend and Neighbor is going to be part of that as well. So more information. I think that one actually is falling in our licensing unit. So I got to thinking about how we might be able to share some time on the state calls to give some updates on those goals, maybe once a quarter or something like that. So we'll work with those other groups so that you guys feel like you're informed, or if you just tell us, oh no, I'm getting this somewhere else, we're fine with that as well. So, but let's dig into our childcare provider quality goal. So this is our goal 4, and our goal is to move 5% of our Colorado Shines Quality Rating Improvement System eligible childcare providers from levels 1 and 2 into high quality. And so each year for 3 years this is a 3-year WIG goal for us. And so to move from 1,093 to 1,442 by June 30th, 2027. So it's a pretty big lift, honestly. I had some reservations about this one for sure, but there is something to be said about WIG goals do sometimes get attention. We're all a little worried about funding for these initiatives, frankly, because there wasn't extra funding associated with them, just our existing funding. And sometimes those can get attention if, you know, we're looking and saying, gosh, we are short, we're not quite meeting our goal. It sure would be nice if we could do incentives or something like that. So we'll just keep focusing on that as we move through that. So I'm introducing the goal today and kind of the lead measures around the goal. as we move into our future state TA months, we'll bring updates as to where we are with these. We actually grew like by 18 programs between July and August. So pretty incredible jump. We also think we had some alt pathways that dropped in and got awarded. So we're going to be watching just some of those, and we'll be sharing some successes along the way too, and some strategies hopefully. And hopefully y'all will be helping us with that. And we're always excited to share things and have you come on and share things that are working well in your community so others can learn from you too. So go ahead, Lilith, with the next one. So we're going to go into, these are the lead measures. Oh, and by the way, these all get dashboarded on the governor's dashboard. Most of these are dashboarded quarterly. So we'll be reporting into the Gov's office for our, whether we're on track or not on these. We have to give a monthly update, but quarterly is when the information gets updated on the Gov's dashboard. So anyway, our first lead measure is to move quality improvement incentive funded providers. So those are your providers you're already working with to get them. So really focusing on your level 1s and level 2s, and that they're following those kind of MOU guidelines of moving from a 1 to a 2 within that 18-month time period, and from a 1 to a 3 through 5 within that 24-month time period. And again, because we don't have extra funding for this, we're really going to have to rely on what we are using and holding our awardees to these goals of meeting their MOU agreement, basically. So that's one of our lead measures. While we know it's not been an easy transition to go from Sugar to Salesforce, and we still have lots of kinks to work out, we are going to get some better reporting this way. So this will be one of those measures that we can build a report for you. You can follow your providers who have signed the MOUs through their trajectory of meeting the goals, and it should be, I'm hoping, a little bit more of a streamlined process for all of us to manage this. So that's lead measure 1. And then lead measure 2, support early childhood councils in increasing quality for providers in their region. So this is just a continuation of our, what some of your coordinators call them WIG calls, your monthly check-ins with your coordinator. So almost all of you are meeting with them monthly or close to that, just to have those conversations about, what are those challenges? What are those successes? What are the barriers for engaging providers to meet those requirements? And again, we're going to be really focused on those MOUs that are currently signed. But if you've got other strategies that are working, that's great too. So a lot of these just kind of bleed into each other, as you will see. You can go on to lead measure 3. So increased childcare provider quality in early childhood councils trending below the statewide average. So all of you guys have a scope of work requirement to support quality improvement. So again, this is not anything new. What this particular measure looks at is we just took a snapshot of data at the beginning of, it was the end of June actually, of all the early childhood councils and where they were with the number of high quality providers in their catchment areas. And I think it was 18 that were under that 30.9% goal. And so we'll just be watching the 18 just to see how we can support you to trend up on that. So that'll just be part, again, of our monthly calls with you, supporting you with those successes and challenges as you go through that process. And our last, I think, or was that our last one? Yay. Okay, so we have these 3 goals, of course, our lead measures, and then we have our overall goal, which they think will lead to us meeting the overall goal. And so, like I said, like when we meet next month, we'll bring you kind of our baseline information and where we're trending I can tell you we've been watching this trend, of course, for years, right? And honestly, we've never really broken the plane of more than like 33% of our licensed providers. So we know we can grow a little bit for sure. But we also know that this is a hard thing because, we've been in this space for a long, long time now, and there's a saturation point to some degree. But those providers who are like newly licensed, really good opportunity for like our quality navigators who have been working with them anyway to like get them on this path and help them through this process. So, but we're excited to hear about, what's working well, what those barriers are, so we can, help support that, or at least report that. And we will continue to be in your court to stand up for, extra funding would be a great thing, because we know a lot of you have wait lists, to support your providers in your community. There's just not enough funds to go around. So sometimes these kind of goals can kind of help us, tell the story. So any questions or comments on that presentation?
We had Diane in the chat about notifying the specific councils about being under that.
Yeah. Diane, I didn't want to call out specific councils right now, but we will get a list, and you'll meet with your coordinators on that. So, we really wanted to get this overview first, and you can see that too. You can run a report in Salesforce now just to see where, what your L3 through 5 numbers are. So, but yeah, so that will be something we'll be working with you guys on. Yeah, Julia, go ahead. Oh, I can't hear you.
Oh no, hold on. Sorry.
Getting there. Yeah, volume up.
Okay, good. So I'm just curious. So one of the things with the new changeover to Salesforce, I mean, as I'm sure you know, we were all real familiar with Sugar and how to pull reports. I'm struggling to find reports in Salesforce. Okay. Is there a way maybe on one of the TA days we can talk about how to do that, or maybe some guide? I mean, like Lilith, I know that we have all the ones for just QI, but that doesn't necessarily include like a 3 to 5 report, or like I need, I've been asked by the college to provide an E&E report. And so I don't know if there's a way to help us understand how to better run those reports.
Yes. Yeah, Julie, absolutely. First off, connect with Michelle, because a lot of these reports have already been built, and we'll just show you where they are.
Perfect.
So, and then the other piece would be identifying what you're looking for that we haven't yet, because we've been so focused on just getting you guys the information that you need now for the QI module that, general reporting has taken a little bit of a back seat, but we are going to get there. And I think that's a great suggestion. So, in the short term, let's have a conversation with Michelle, and in the longer term, we'll work on that to help you guys with where to find those reports. And we will also just start to be looking at what everybody needs to run the reports. So plus we got to run these reports anyway. So we've been working with our data team a little bit on that to give Dorothy a break. So she's got a lot going on. So we'll put that on a list for future. Good suggestion. Thank you. Michelle.
So I was just going to add also that part of the issue is we have a lot of these reports built, but it's also knowing who has access to them. So that's something else we need to work through, is figuring out what reports you guys are needing access to, and seeing if they've been built, and 2, if you have access to them. So
Right.
it's gonna be probably a little bit of a journey for us too, trying to figure out all of those needs.
Yeah, for sure. But yeah, start with your coordinator and we'll go from there.
Does anyone else have any questions for Karen or the team?
I am assuming Carolyn missed, unless she jumped on. Just got her times messed up a little bit. I know she was really, really excited to come on and talk about this website rollout. But we will get you some information or get her on the next call or get her on a hot topics call, one of those options. So I apologize that we got our wires crossed today.
And Christy has a few more updates for her time spot. So if there weren't any questions for Karen at this moment, we just have Christy come on really fast and finish her updates. And then it looks like we might end a teeny bit early. So Christy, if you're ready.
Thanks, you guys.
Of course. Thanks, Karen.
Yeah, thank you, Lilith. As you know, when we start talking about E&E, we tend to keep talking about E&E, and I mistakenly forgot to give you an update about our health and mental health grants. So we've been able to get some extra funding, and for about 150 providers that applied last spring for the health and mental health grant, we're able to award them. They're going to find out in the next couple of weeks, and they'll get their payment by the end of October, and they'll have until the end of May to spend their health and mental health dollars. So we're very excited about this. This will actually be our third disbursement of funds specifically for the health and mental health of early childhood providers, families they serve, and the children that they serve. So very exciting news, and just wanted for all of us to end on a positive. That's that.
Great. Does anyone have any questions related to that last little bit of updates that Christy was able to give us? If not, unless anyone has anything else, questions about anything that was presented today, we will be sending out all of this information in our, yes, Stacy.
I may have missed this. Did you give us any update about minor improvement grants and when those decisions or awards will be made?
We did not. I believe that my team is, we are reviewing our final kind of prioritizations this week, and then by next week, we should be communicating with councils to say, okay, these programs will be awarded the grant, and etc. So those communications are coming very soon. We're just finalizing a few things.
And Stacey, I just wanted to add to that too. Like, we know that ECHLA's grant's dropping for the family childcare home providers, and this might be great news if you don't know this. I know the SSB group was on and they mentioned the PDG initiatives. We also have an ask in with the PDG grant to have additional funding for it almost mirrors the minor improvement grants. It is for programs who have infants and toddlers. And so it could really help with some of the massive amount of information we got, like way, way, way beyond what we could award. So that could also be kind of, we were kind of hoping that we could combine these funds. And so anyway, we'll keep you updated. So we were like, if we could push just a week more, we might know more about the PDG grant as well. So that could help us a lot. So, but there's, we have to also figure out the caveats that might be associated with that once it's finally approved, because sometimes they'll change like what we've presented. So all of those things will be hashed out here in the next couple of weeks. So thanks so much for your patience, you guys. And I apologize. I'm sure your providers are very, very anxious at this point. We also had, I know a lot of our coordinators, reached out to a lot of you to say, help us prioritize, because the application information that came in all looked so similar. It would have been very difficult for us to like make decisions, right? So we've been having those conversations with you guys as well. So some more to be announced here in the next week or two.
Thanks, Karen.
Julia, it looks like you had your hand up.
Yes, Lilith, I just have a quick question. Is the council only going to be notified about the minor improvement, or is it also going to go to the provider?
We will be notifying you, the council, so that
And
you
then we can notify.
They can
the provider.
apply. Yeah.
Okay.
Yes.
Well, no, I just mean for the awards of the previous, if there is any of that new minor, because I know we submitted several, and I just want to make sure that we're not, we submitted them for the providers because we wanted to make sure they were good asks and stuff. So I just wanted to make sure that was coming to us, and then we can reach out further.
Yes, we will. Coordinators will be reaching out to councils to be able to give that information to those providers that are awarded those funds. And then that means that the provider still needs to put in a spending request in Salesforce. So in their Colorado Trend portal.
Oh, that sounds like a whole nother thing, but we won't get in that today. We'll talk more later, I'm sure.
Yeah, Julie, it'll look almost exactly like what they had to do previously. I know you guys actually did some of that on their behalf, but they'll just need to do that, but it won't be difficult.
That leads me to just one more thought for next month, maybe, is around or additional documentation around how to put orders in on the back end. I mean, because a lot of times we have providers and we want them to do it themselves, but it literally comes to they're like, we don't have time. I'm in a classroom. I don't understand technology, and how we can best support them. So like with some of the challenges we're having with the marketplace vendors and stuff like that, we're just like, give us the orders and we want to put them in. But it's still so new to us in Salesforce. I don't know if there's potentially another Salesforce kind of training we can do.
At this point in time, you cannot do that for them. And the reason is it's an audit issue. And I don't know how many of you know this, but we had a pretty significant breach in this system 3 years ago with some problems in that area. And we had to set this up differently. Now, that doesn't mean that a future iteration could create some other efficiencies where you could support the provider, but the provider still would like acknowledge that. And that is just something that we had to do, unfortunately.
I appreciate that. I know that it's a challenge, but I know with as busy as some of these providers are, that things like putting orders in.
I get it.
Yeah, it's really challenging.
But they're also getting stuff, and they're also getting money, and usually with a grant, there is some work on their end. So we're going to we'll have to coach them a little bit. So if you needing some support with that, for sure, we can help. We can we can try to get some documentation pulled together that will help them kind of step through that if we don't have it already.
Yeah, we have the documentation for spending for providers, and it will mimic that documentation. So once that's kind of once you know who the providers are and they're ready to jump in there, which is probably right away, we'll have extra documentation just to walk through screenshots and everything through those minor improvement requests. Because there's a different button that says minor improvement. But really it'll follow the exact same the layout that they've been seeing in there since kind of like.
But I realize it's different, and so that's it's a change management process. It's not going to be as easy because you might be waiting for them to get this done. So yeah, so thanks for understanding that. We'll just continue to keep thinking of ways to help support that.
Any other questions, comments about anything presented? If not, we can go ahead and end 30 minutes early. We can all have 30 minutes back to, of course, get back to all of our important things that we're working on. Just want to say thank you so much to all of the council's that have supported this work, that continue to be patient. Everyone is helping out and learning as we're doing this, and just want to say thank you. And you're instrumental to this work. So it's change is hard, and we can all do hard things together, even though they're hard. Working on my son's growth mindset mentality, and so I have to keep telling myself, man, this is really hard, but we're going to get through this. So kind of keeping that mental piece first and foremost. Yes, we are in this together. It's yes. Thanks to everyone. I'm going to go ahead and stop the recording.